UnitedHealthcare is on a mission to help people live better, healthier lives. In order to accomplish that goal, they're tailoring their efforts to support whole person care by partnering with community organizations that do too. Each Tuesday for the past several weeks, representatives from UnitedHealthcare visited with us to share about the endeavor. This week, UnitedHealthcare Community Plan of Kentucky CEO Amy Johnston is here. She's brought along Patricia Tennant of Kentucky Youth Advocates to discuss how the two entities are collaborating to support kids in our community. Welcome to you both. Amy, why is this personally so important to you?
Well, thank you, first of all, for having us again. It's really been a pleasure to continue this discussion.
Couldn't agree more.
So for me, I'm adopted. And being able to talk about the amazing opportunities I've been afforded because of that is really something that I couldn't pass up. You know, foster care is something that is growing. In the state of Kentucky, we have a lot more children in out-of-home situations, and there's just amazing work going on with partners like Kentucky Youth Advocates to really try to keep children in home where it's safe, and we're able to do that. So,
speaking of amazing work, though, I mean, you've been our guests every Tuesday and look forward to that. Why is UnitedHealthcare on such an incredible mission to partner with so many important organizations in the community that are helping people to live healthier, better lives, and people of all ages, kids included?
Absolutely. So UnitedHealthcare, you know, our mission is to help people live healthier lives. And we know that children in the foster care system often suffer from increased physical as well as behavioral health needs. So really taking care of that whole person is essential to help give them a good start as they move forward in life.
Patricia, Kentucky Youth Advocates, what's the mission of your organization?
So our mission is to be an independent voice for Kentucky's children. There's over 1 million children in our state, and we want all of them to have a healthy, safe, secure childhood. And core to that is we know that what gets measured gets changed. So we collect county level data on child well-being through our Kids Count project. One of which is a data point on children in foster care. And as you've discussed, that's a data point, we've seen that increasing in 93 out of 120 counties around the state. And so in partnership with UnitedHealthcare, we've been able to raise awareness of that, take that data to communities to talk about how can we go upstream. And when families are in crisis, are there ways that we as a community can come around them together and support them to prevent kids from going into foster care?
What are you hearing in these conversations? And I know you've held them in Louisville, Paducah, Glasgow, Manchester, Covington, and Hartford. What are you hearing people say?
Yeah, so it's really interesting. We found that it's just having a cross-sector group. So we've been having faith leaders, superintendents, family resource coordinators, first responders, people who touch children's lives and don't often do a good job of talking to each other about it. So one key thing is just being aware of the resources that everybody provides and thinking about ways that they can collaborate better. We've also heard that, you know, parenting is tough and it doesn't come with a guidebook. And so there's a lot of need in communities to help parents build their skills and to think about how they can keep their kids' health and safety and keep the family together. And so there's been also, UnitedHealthcare offered a matching grant to the communities we visited, $10,000 then to put an action plan together. And a lot of them are using that to offer services to parents and think of ways to collaborate better for kids.
Amy, like you said earlier, you're adopted, so I mean, to see UnitedHealthcare providing a matching grant like that and knowing that you're helping to give voice to our children has to be rewarding.
Oh, it absolutely is. You know, in the past year, in 2018, UnitedHealthcare served over 65,000 children in the foster care system. So it's something as an organization, it's our company core values to really help provide opportunities and really improve health outcomes across the community. So for me personally, as well as from an organizational perspective, it's just a mission we're really passionate about.
I know you're saying Kentucky Youth Advocates, I mean, one of the things you're trying to support the families and so kids don't go in to foster care.
That's right. Yeah, and that can be, you know, making sure they get treatment. If it's, you know, one of the big drivers is addiction to substances. Yes. It can be providing respite care to foster families when they need it. It can be wrapping around, those basic needs. The housing assistance is big, food insecurity, making sure that those things that are really putting that family in crisis, that they're doing the best job they can to connect them to the resources that they have so that it can stay together.
We also know we have an astronomical amount of kids who are already in foster care and available for adoption. And both of us being adoptees, I always encourage viewers, consider that.
Absolutely.
We were
Absolutely.
blessed.
We really were. Having that home placement out of foster care, it's really an amazing experience. And kids going through the journey to know that so many people care about them and care about their voice. We have 2 more Kids Count sessions coming up this summer, so really excited to meet with those parents and community-based organizations to continue to wrap that support.
Well, thank you both for sharing. To learn more about Kentucky Youth Advocates, go to kyouth.org. And for more information about UnitedHealthcare and their work, head over to uhccp.com/ky.